Bianca, if you could please go on to the first PowerPoint, excuse me, the first slide.
Can you see my screen?
Yes, I can see it
Perfect.
perfectly. Thank you so much, Bianca. This manifesto is really, it's about a unified approach to multiple sclerosis, to MS. I'll be using the terms interchangeably throughout this session, but we are just so happy to have you all here, and I am joined by a great number of my colleagues today, and it's really wonderful to see all of your support and to have the team here with me today. During our webinar, we're going to have a number of speakers. Before I get into that, next slide, please. We're going to have a few points on the housekeeping. I'd like to remind you to please keep your microphone on mute. But more importantly, we would love to know who's here. Please, would you change, if your name isn't already there, your name and your organization so we know who's taking part in this event. If you would like to make any comments, please send your questions or comments into the chat. If you need any assistance whatsoever, my colleague Bianca, you can see her email address there, and we will be happy to help you out. Also, if you are going to be speaking, please keep typing or other background noise to a minimum. Again, the mute button is really important, as we all are familiar with, having had so much interaction online more recently. So without further ado, we're going to carry on to the webinar. Next slide, please, Bianca. So really, this manifesto, it's about a unified approach to multiple sclerosis, a unified approach to the care of the more than 1 million people with MS in Europe. And it is an issue that we in EMSP and our member organizations have been working on for a long, long time. It is about unifying the different approaches, and this manifesto has been developed with our members, with significant input from our team, with people who have extensive expertise on the issues. And it is about responding to the urgent needs of more than 1 million people with MS in Europe. We're talking about people in your town. We're talking about people in my town, in cities, villages, rural areas, in places where care is unavailable, where there's no treatment, where treatment is hard to access, and where to be diagnosed with MS can mean stigma. It can mean a lifetime of limited resources. It can mean devastating life changes, discrimination, and being excluded from your community. It has massive implications, and that's something I want us all to keep to the forefront of our minds as we're going through this launch and through the activities in the months and years ahead. We're really talking about the injustice of our societies. We're living with a lifelong illness or living with a disability, turns your life upside down, but also you cannot access the resources that you need. Next June, in 2024, constituents of the European Union, EMSP is a European organization, so we extend beyond the European Union, but we do notice how important lobbying and engaging with our parliamentarians is so important for the work that we do. But you have a great role to play by using your voice and your vote to call for actions, as we have outlined in the manifesto. In the manifesto, I encourage you all, not right now, but at the end, if you haven't already, to review the content of it. Some of the main points of it are to make enhanced care delivery and high quality rehabilitation services a cornerstone of the work of the EU institutions. This looks like the right care and the proper care at the right time in the right place, and with the person with MS at the center of what's happening. We want to empower the European workforce through inclusive employment and education practices and enhanced social support. We want to ensure people with MS, especially young people, can stay in employment, can stay on their career trajectory, and to continue in the employment market, and that it is open to all people. We need to know the numbers of people with MS in Europe and in the EU, and we will do this by incentivizing data collection and research. We want to foster a collaborative approach to enhance understanding and management of MS on a broader scale. We want to ensure that the advancements in research translate into tangible benefits for people with MS. It's all lovely to have research, but we really need to make sure to have research and activities, but the research and activity must have a positive impact on the lives of people with MS. Today, you're going to hear a range of voices doing work in different areas of society and health. And we're going to hear from 4 different speakers from 4 different countries and in many different areas. Their work touches many different lives, but also they have an impact in many different areas of the MS community, but on a broader sense in the European Union and in their community and the European disability field, for want of a better term, excuse me. First of all, our first speaker, Debianca, please would you change to the next slide? Our first speaker is Jana Lacheva, and she's part of the Czech Ministry for Health. She acts on strategy and is a liaison for patient organizations. She is going to share with us her experiences working in the government where decisions are made and budget lines are important, as we all know. But Jana, if you would like to take the stage and share with us about your opinion on the manifesto, the importance of it, but in particular, we really want to hear from you about the work that you do and how the work of EMSP and our member organizations can have an impact on the work that you do. So over to you, Jana. Thank you.
Thank you very much, Emma. And first of all, I would like to congratulate the EMSB on the manifesto that I had a chance to read, as I would like to speak about the importance of the unified voice when it comes to influencing the EU policy so that we can achieve improved healthcare, social care, and inclusivity for people with MS, because it's only the unified voice of people with MS that can bring this to us. We have to make our messages clear, loud, as one man or a woman, so that these messages can be heard. Because if we just have to imagine how the decision making looks like, how the scenario works if you walk through the parliament, through the European Parliament, or any parliament actually on the national level, how many problems are on the table, how much information, and the constant lack of time. The worst thing that really can happen to us is if our message is diverse, if they are different. So thank you so much, EMSP, for making our claims to one to one paper, to one document. Thank you very much for that. But today, as Emma said, I will be speaking not only as a person with MS, but also as a civil servant working at the ministry that shall put a lot of actions of the strategies, of the European strategies, into life on the national level. And as such, I'm really, really filled with anticipation. What the 2024 and 2027 EU mandate will bring to us, as it will have a huge effect on national level and on the lives of people with disabilities and people with MS as well, of course. So I prepared a little list as a civil servant. I will be speaking as I, but it doesn't necessarily mean me, but any civil servant at the ministry, just to make the message clear. So, how these actions, be it the European strategies, European legislation, European programs, the monitoring activities, how it affects us. So, as a civil servant, uh, any national strategy that I'm writing, I have to look at the EU strategies. Once I have to, but also I really want to, because I need the ideas, I need the know-how that comes from all of the European countries. I need the support, and I have to harness this. Then, in every law I'm writing, I have to comply with the EU legislation, be it directly applicable regulation or the directive, the goals of which I have to implement. Then, very importantly, last but not least, the programs, uh, because, sorry, um, if we want to put the strategies and the law in practice and support actions, we have to find available funds, including by using the EU funds. And of course, the great impact is the monitoring activity of the EU institutions. For example, what you will read in the manifesto, for example, the Council recommendations based on the care strategy. If this is passed, of course, as member states, we will have to inform the Commission on the measures we have taken to implement the recommendations, and to which we need assistance to comply with some of those. So then we are greatly appreciative of the support to the reforms and the investment that shall be made to make this reality. So all of this influences my work, that influences the actions on the national level that affect people living in the country. And what can influence the decision making on the European level? Well, there is in the legislature, setting the strategies, preparing programs, there is a huge role that patients and patient representative can play. And another list, of course, as a civil servant, I will bore you with those all the time. But the role is important to come up with the needs, the problems that need to be tackled and solved. So again, thank you for listing them up in the manifesto. We have to show patients' representatives the problems, and to make them understandable and relatable, because the decision makers are, of course, human beings. They are people. It's important to bring stories, but also it's very important to back them with evidence so that we illustrate and support the evidence-based decision making. We have to explain and show the importance, because all the time we are competing with the time and resources that are, of course, limited. It's the role of patients' organizations to make requests, because it's for the rights of people with disabilities, the people with MS, but it's also expected from them. It's important that the patients' organizations and patients' representatives help to find these solutions. It's always better to be a reliable partner that comes up with the solutions as well. From the experience that we have and from what it works elsewhere, very important is to show the impact of the problems that people with MS face, but also the solutions, and show that these solutions are vitally applicable. We do not necessarily need a legislation simply only dedicated to MS as one disease, but it's important to make sure that many more will benefit from these same actions, using MS as example. So making these messages clear and simple, coming with stories and data and possible solutions, we are building the case for public authorities to make the actions, and always bringing the message that this is necessary, but also this is doable. So, and when better to start now, ahead of the European elections, than with appealing to the candidates for the members of the European Parliament, the ones that will be representing people of the European Union, of the different states. So, bearing in mind that what happens in Brussels, in Strasbourg, has a direct impact on daily life and realities of people with MS, which is more than 1 million people in Europe. So this is how I see the impact that the manifesto can have. And again, thank you very much for this, and thank all the partners for being here with the people with MS.
Thank you very much, Jana. That was a comprehensive. I love your lists, and thank you for doing as we expected you to do as a civil servant. But you bring so much more, and thank you so much for that contribution. I wonder if anybody has any questions for Jana. If we can have them now. I don't see any in the chat, so we can hold them over until the final speaker. We can have a Q&A session at the end. Thank you very much for that, Jana. Our next speaker is Anna Ravila. She works in one of the main European organizations, and in her professional life, she is from Girona in Spain. She is an important part of the EMSP Young People's Network. She's a brilliant activist, and she's going to share with us now how the manifesto can impact young people in the EMS community and how they could use, they have been part of building this manifesto. So how they can use this and also the active role that they can play in the elections next year. Over to you, Anna. Thank you very much for being here with us today.
Thank you, Emma, for your introduction. Hi, everyone. I'm Anna, and I'm a member of the Young People Network here in EMSP, and I'm currently a human trainee in the European Parliament. And I'm also an MS patient myself, and also a patient advocate. Young individuals with MS often experience vulnerability in certain situations. In my in my particular case, I find myself struggling with all the challenges and difficult issues from moving abroad within the same EU. So, in my case, despite some advantages in the form of a substantial grant and healthcare insurance, I feel that the opportunities available to me are not equally paired with those of my colleagues. That's why I think that the EU still has the duty to work on better policies for MS patients in order to ensure social protection and labor protection also. We want to make our politicians know that we want to keep working. We want to continue contributing to the workforce. We want to have equal opportunities when moving abroad for work. But we also want our needs as patients to be heard and taken into account. So adaptations can then take place whenever it's necessary. I would like to conclude my little words with the concept of faith. It's important to keep fighting for the improvement of our rights, but also to have faith. We hope that the next mandate will take us more into account and that everything that is being manifested today will start to be closer to a reality than just words. But what's even more important than faith is the power of community. By joining force, we will surely go much further, and this is the path we have to follow to continue to improve our rights. So thank you.
Thank you, Jana. Excuse me. Thank you, Anna. Thank you for sharing with us your perspective and also giving us some insight as to the current situation for young people with MS. I suppose battling what's going on for you and for people in your network and in your community, and how the response still is not meeting the needs of young people with MS, which is quite extraordinary given the amount of work that has been put into bringing about social change. But it does emphasize the importance of us continuing to work on the issues and continuing to bring things to the fore. Anna, I wonder, having read the manifesto, would you see it as motivating and empowering for young people with MS, or what way do you see you're going to use this in the months ahead?
Yes, I have read it and I think it's motivating and it's important to read it carefully and just to keep on working and investing our time in order to get some more achievements and improve our rights.
Super. And with the given where you're working, what would your one ask be to elected officials and in the upcoming European elections?
As a
I
tra-
know, I'm asking you a hard question. Just make it just
Yes.
one.
As a trainee in the European Parliament, what I see is that not a lot of people with disabilities are either workers or politicians. So I think that people with disabilities should have more space, as 1 out of 5 people in Europe have some kind of disabilities. This percentage is not represented in the institutions. So it's important to keep on working and to try to have a better representation for us.
Thank you for that, Anna. And thank you for answering my on-the-spot questions. And what you have just said in the last couple of minutes is a nice segue to our next speaker. Catherine Naughton is the director of the European Disability Forum. She has a unique insight into what EDF has been working on. But in particular, yesterday was the International Day of Persons with Disabilities. Excuse me if I haven't got it correct. And Catherine, I am sure that you have a follow-up from what Anna has just said about representation in the Parliament of people with disabilities. And I would like you to take it away, Catherine, please. And thank you so much for being here with us today.
Thanks very much, Emma. And thank you to the European Multiple Sclerosis Platform for inviting me to be part of your meeting today. It's a good opportunity for me to read your manifesto and to see what your priorities are, because of course we will all be campaigning now and in the coming year for in advance of the European Parliament elections, and then afterwards as well, to see what we campaign for European leaders to do together. So for those who don't know, the European Disability Forum is an umbrella organization like the European Multiple Sclerosis Platform. And our members are national coalitions of persons with disabilities, national councils, national umbrella organizations, and also European-wide organizations like your organization. And so we had a very big event and consultation process this year with our members to develop our manifesto for the next European Parliament elections, which I think includes a lot of the priorities that you have already in your manifesto, but not all of them, and not with very specific reference to people with multiple sclerosis. So we have, also as a shared priority with you, issues of employment, accessibility, reasonable accommodation. We probably have less than you have on timely and equitable care, because the European Union hasn't got such a leading competence around health. I know you're focusing on research, but around health and directly provided services at national level. We work less on this, but we are working in the next 2 years on guidance on inclusion and access to health services for persons with disabilities. And so this is something that maybe you can get involved in. We have an email expert group on this, and perhaps this is somewhere where we can make sure that the priorities of people with multiple sclerosis are included there. Also, your priority on the comprehensive European strategy on the rights of persons with disabilities. So we know we have the strategy at the EU level going up to 2030, but all the actions only led up to now. So we can work together to put in place things that are priorities for you in the coming 5 years. And I see that support and employment, reasonable accommodation are extremely important. Often people with multiple sclerosis are not recognised as having a disability, so not always given the kind of support and reasonable accommodation that they should have. And sometimes the accommodations at work aren't provided and people end up being out of work. So this is something that I hope that we can work on together. And your emphasis on research, I think, is also important, but that research centres on the priorities of people with multiple sclerosis and puts them at the centre. And then also often the results of research are not translated into direct changes in people's lives. So this is also something that we can collaborate on. So I would like to offer every support that we can in disseminating your manifesto. And I would encourage you to join together with us on our work on access to healthcare and in any of the other working groups, for example, around employment or places where we can really work better together to make sure that in our general disability rights advocacy, that the particular situation of people with multiple sclerosis is fully included and recognised, because I know it is not always. So thank you very much again for the invitation today to speak and to hear all about your work.
Wonderful. Thank you so much, Catherine. Your support is invaluable and the support of your organization as we continue with this, I suppose, pushing out the manifesto and the different items in the manifesto. And long term, that we are working side by side and working together because there are so many similarities and we overlap. And as Anna alluded to, we go further together, and when we're able to join our efforts together, given that so much of what we do in EMSP and in EDF, so many of the people we work with and work for are the same people. But overall, the idea of equality and people having opportunities as well as the outcomes that match normies in the community, let's say. So thank you so much, Catherine. And we will be hounding people on socials later on today. We're going to have a Twitter storm and or X. I don't know how I can say we're going to have that on X, but so we will be working with you and your colleagues. So watch out, MEPs or any public representatives, because we're going to flood your inbox later on today. Our next speaker is Trishna Badara from the UK. Excuse me, Trishna, for mangling your name. She works with a range of organizations as a leading patient advocate and so much more. She has more recently been involved with healthcare professionals and clinicians about including people with MS in research and their work. Over to you, Trishna. You're going to share with us a little bit about your take on the manifesto, but also how important the manifesto is and will be to people, to patients, and to people working in the MS community, so healthcare professionals, and how you see it impacting your work and the work of the people you work with as well. Over to you, Trishna, and lovely to see you. It's great to have you here today with us.
Thanks, Emma, and thanks EMSP for inviting me. So hi everyone, I'm Trishna Baradia and I'm a patient advocate living with MS. So I was diagnosed in 2008, age 28, and I'm based in the UK. As a patient advocate, I work with lots of different stakeholders within the healthcare ecosystem and also the medicines development life cycle. And I really work to better embed the patient voice, whether that's with patient groups, with industry, with clinicians, and many others. I believe that we all have to work together in order to improve support, services, and information for people who are affected by MS. Now, I've been asked to speak about breaking barriers and the importance of this manifesto in doing this. And I'd like to really start by saying that I'm endorsing this manifesto because it critically addresses many of the key challenges that can prevent people who are affected by MS from across Europe from being able to live their lives fully. It really provides a tool to voice patients' needs. And as someone who has been diagnosed with MS myself for 15 years and who has worked with the MS community for almost the same length of time, I'm fully aware of how MS can impact virtually, if not all, aspects of your life. Now, I personally have been affected by many of the areas that are covered in the manifesto. And I've also worked with organisations both in the UK and across Europe to address some of these issues. Now, some of you may have known of Helen Keller, who was an American disability rights advocate. And she once said that alone we can do so little, together we can do so much. And that's why endorsing this manifesto is so important. Because as people affected by MS, whether that's we're living with it ourselves, we're a caregiver, we're working for a patient organisation, we're working in industry with people who are affected by MS, we can all play our individual part in advocating for and creating change. But bringing those voices together, collectively calling for change, and having a tool like this manifesto that galvanizes support from decision makers, and in this case, MEPs, it's imperative for moving the needle in MS care. Now, when I first read the manifesto, what really jumped out at me was the clarity with which it's been set out. The challenges have been identified through the gathering of evidence, which is so important, particularly when you're working with organisations. And then the solutions have been proposed. Now, it's ambitious, but that's good because the proposals are also practical and they're doable. I also believe that every single person affected by MS, whether that's someone who's been diagnosed with the condition or someone who is a caregiver, regardless of where they are in Europe, they'll be able to identify with and relate to at least one, if not more, of the unmet needs that has been outlined in the manifesto. And then a key part of the manifesto is also around how to improve healthcare systems and facilitate access to care and have appropriate, timely care from healthcare professionals. Now, something that I hear time and time again from MS communities across Europe is a lack of available experts in MS, whether that's specialist MS neurologists, MS specialist nurses, other healthcare professionals like rehabilitation professionals or psychology professionals who have specific expertise in MS. Making it easier for healthcare professionals to develop this expertise is, in my view, imperative for improving the healthcare for people with MS. And this is outlined in the manifesto. If we optimize the expertise in the system, it will work much more efficiently and effectively, and ultimately, patient access and care will improve. And then linked to this, I think integrated care models are also incredibly important for people living with MS. And that's because of the multidisciplinary nature of the condition. Having a coordinated and holistic approach will, again, ultimately be better for the patient. But this is only possible if we look at how the systems are structured, if we build capacity, if we build expertise, and we allocate resources. And I'm not just talking about integrated medical care, I'm also talking about incorporating the social care needs as well. Again, something that has been outlined in the manifesto. But finally, I really want to emphasize that when I talk about the MS community, I'm talking about the entire MS community. And that means everyone. We know that there are sections of the MS community that have traditionally been underrepresented and marginalized when it comes to MS care, when it comes to advocacy, when it comes to services, when it comes to information. So how do we ensure that their voices are also heard? Well, this is something that is really important to me, particularly as an Asian person who is living with MS. And I'd like to call on the MS organizations across Europe to really look at whether they're reaching all sections of their MS communities. And if not, why not? And these MS organizations could be patient organizations, they could be organizations, companies within industry, they could be organizations as in academic institutions or political institutions. We can't say those communities should be reaching out to us. No, there needs to be intent when it comes to diversity, equity, and inclusion. And that means possibly looking at new ways of doing things, reaching out to people in a different way. It might mean partnering with minority groups rather than saying that they have to be a part of your organization in order for them to be heard. Now, the MS Society in the UK, which I do a lot of work with, has actually embarked on a number of really excellent initiatives to address some of the challenges of diversity and inclusion. And I'd really recommend having a look at their website, getting in contact with people from MS Society UK in order to find out a bit more. Their current equality, diversity and inclusion strategy was developed with people from the MS community. The EDI reference group, which I'm a member of, helps the MS Society to deliver the strategy. And the Leaders by Experience program is helping advocates from minoritized groups to be able to work with their communities and empower others to get involved. And we do need to do this, because if these voices aren't heard, then we won't be addressing the challenges or the needs that they have. We need to be working for the entire MS community. And that's one of the reasons why I'm endorsing this manifesto today. Thank you so much for listening. And also thank you again to EMSP for having me and for inviting me today.
Thank you so much, Trishna, and thank you for that comprehensive and powerful speech to us all. I want to reflect back to you on diversity and inclusion, but also on the different ways the UK MS Society is responding to the community and to patients. Do you see what is being done in the UK as a good example of how we can share that with our other European members? Do you see that as a good framework?
Absolutely, because it's coming from top down, bottom up, inside out, outside in. They're really looking at it holistically. And the one thing that they haven't done, which has happened in the past, and the MS Society has been very open and transparent about saying, hey, look, we haven't always got this right. We've made mistakes, but we're addressing those now, and we would like to work together with traditionally underrepresented groups in order to get it right. And there's been a real openness and honesty about it, which I think has been really refreshing and also really effective. One of the key things which I think has really worked and which I think could be particularly of importance, or could be a way that this is replicated amongst other MS organizations across Europe, is what I referred to when I was talking around basically not saying to underrepresented groups, you have to come and join us, you have to be a part of us in order for your voice to be heard. Because sometimes if those groups don't see themselves reflected in the MS societies, which are, large, well-established organizations, they may not currently want to be a part of that organization just to get their voices heard. So one of the things that the MS Society in the UK is doing is they're partnering with grassroots organisations. So they're holding things like webinars and talks and events in collaboration and in partnership with grassroots organisations that are working with underrepresented groups and saying, let's work with you.
So making the space,
exactly.
And not just what are we going to do, but actually making the space and making it welcome for everybody.
Absolutely.
Thank you for that, Trishna, and thank you for your endorsement of the manifesto. It's really important to us that we do reach everyone in the MS community, people of color, people from different minority groups, poor people, travelers with MS. We still see a number of people in marginalized groups not represented in the MS community. And I hope that this manifesto is a way for us to move over a little bit and make some space for everybody to come into the community and for them to feel their voices or to know that their voices are heard. So thank you for that, Trishna. We have a couple of minutes for questions. I'm not seeing anything in the chat, but please, if a member of the team has something that has come up, please speak now, because I'm seeing different things on my screen. But for now, I don't see any particular questions in the chat. So I would like to now move over a little bit for our president, Herbert Temez from Germany, who's going to speak a little bit about his perspective on the manifesto and how important it is to the work of EMSP and our member societies across Europe. Herbert, when you're ready, please.
Yeah, thank you, Emma. Hope you can hear me all. And
lovely. Hear you perfectly and see you wonderfully. So go ahead, Herbert.
Yeah.
Thank you.
Yeah, first I want to thank all of you who join us today and all of the active participants and for your comments and remarks. We have heard just some really important things, and I think we consider that for how to bring that into a manifesto. I'm sure that we together will build a better Europe for people with MS and other neurological conditions and people with disabilities, their carers and their communities. This petition is a response to the urgent need to address the unmet needs faced by over 1.2 million individuals living with multiple sclerosis all over Europe. The complex nature of this disease, multiple sclerosis, makes it an ideal case study for strengths and failures in health and social care. Our vision for care of MS was inspired by the WHO organization's framework for integrated care. We firmly believe in the aim for all people to have equal access to quality health services that are co-produced in a way that meets their life course needs, are coordinated across the continuum of care, and are comprehensive, safe, effective, timely, efficient, and acceptable, and all carers to be motivated, skilled, and operate in a supportive environment. Countries that fail to provide quality care are failing their communities. There are currently huge and unacceptable inequalities in the care of people affected by MS and other neurological conditions across Europe. In particular, in access to timely, appropriate healthcare professionals, and social support for people with MS and their carers. We can't accept inadequate standards of care today and in the future. EMSP's MS Barometer 2020 shows that the entire MS community has a lot of work to do. Policymakers and decision makers from the local to the European level must immediately secure sufficient and consistent funding for health and social care systems to provide people with MS with the clinical and practical support that meets their needs. We must facilitate access to employment and secure disability benefits and social support for all people with MS and neurological conditions. These services need to be available from the life-changing moment of diagnosis and be responsive to changing needs. Intersectoral collaboration and understanding is key. The health, social, education, and employment sectors must be organized around people with MS. Communication between these typically separated fields should be reinforced. Today, we ask the EU and national policy decision makers to commit to the empowerment of individuals with MS throughout their upcoming mandate from 2024 to 2029, to champion the principles of human rights, equality, social inclusion, and social protection for the MS community, to actively contribute in creating a more inclusive, supportive, and empowering environment for the MS community in Europe. Therefore, I ask you and all of your partnering organizations, partners and supporters, all MEPs and EU institutions representatives to endorse this manifesto. I ask all individuals affected by MS, neurological conditions, and people with disabilities to sign up this petition. To make this manifesto successful, I ask you to join us during the years 2024 to 2029 to influence positive changes and to improve the quality of life of the people with MS and neurological conditions in Europe. Before I come to the end, I want to thank the team of EMSP, the agency that helps us to make the manifesto ready, and all EMSP members, my colleagues from the EMSP ExCom for support and pre-reading, and all of you who join us today. Thank you. And back to you, Emma.
Thank you for that, Herbert. Much appreciated your input to our event today, and also to steering us as we develop the manifesto and giving your insight. It has been so important. We are about to wrap up the event, and I would like to say thank you to our sponsors. You can see their logos there on our screen. They provide EMSP with the support to carry out some of our work. So thank you to our sponsors and industry partners. A big thank you to the speakers, to Jana Lacheva from the Czech Republic, to Ana Revilla from Spain and the Young People's Network, to Catherine Nocton from the European Disability Forum, to Trishna Baradia from the UK, and Herbert, I have thanked you already, but I'll give you another thank you. I would like to say a massive kudos and thank you to the team members who are here on the event and on the call. They have worked so hard on this manifesto and on the build up to this day and to the campaign. A big thank you to Elizabeth, to Joris, to Samina, Gilles, DeBianca, Pat, and I'm sure I've missed some people. In addition, thank you to the RPP team, especially Giles and Mehi. There are other members of RPP who have been instrumental in the development of the manifesto, and thank you so much for your help now and in the days and weeks and months and years ahead. To you, our attendees, thank you for your questions. There are a number of questions that we haven't been able to get to today, but we will certainly endeavour to respond to you. For those of you watching on the live stream, this is not a passive event. This is about getting engaged and getting involved. We want you to get busy and add your own personal effort to the energy from today by joining our campaign. We ask you to sign the petition on wemove.eu that calls for quality access to care for people with multiple sclerosis and neurological conditions, and then share it on your socials. At 3 o'clock today, Central European time, If you're on Twitter or X, I'm a bit old-fashioned. I'm still used to Twitter. Please join the Twitter storm by liking and sharing the posts from EMSP and our members, and also sending them to your MEPs. Whilst this is the end of this event, we are continuing something wonderful and powerful. And with the elections mentioned a number of times during this event, there are European elections coming up in June 2024. And I understand that many people stay at home during elections, not believing that anything will change. But I urge you to believe in the change, because if you don't vote, your voice can't be heard. We want you to see and to use your personal power. We are in this to progress towards equality for people with MS and people with neurological conditions, so everybody receives better care and their lives are improved, because right now it is unacceptable how people with MS are being treated in my country, in your country, and in different countries around Europe. Please support and endorse the manifesto. We are going to have to tap into our collective energy to sustain one another, and we'll do this by coming together and joining our energies together. We caught a glimpse of our potential in a recent MS survey run by my colleague, Patricia. More than 16,000 people took part. Please get informed about your MEPs running for election in 2024 and make it your business to share this campaign with your community, with your family, even though they probably won't want to know if you're always sending them things. But please, family and friends and strangers, to any public officials or representatives watching now, please commit to people with MS by endorsing the EMSP manifesto. We are part of a rich legacy of powerful and brilliant people who refused to be cowed by anything, not by this disease. And I see people here today attending this event. They have not been cowed by this disease, and they have not been cowed by prejudice. And they have seen closed doors and tried to open them and push them open. There are people who have never stopped working to improve the lives of people with MS. And I'm asking you to carry the mantle this time by using all of your tools. It's much easier now to use social media. So sign the petition, get your public representatives and MEPs involved to endorse what we're doing, and use your vote in the elections in June next year. Please join our Twitter storm today between 3 o'clock and 4 o'clock and actively like and share our tweets, but also make some noise about the campaign using the hashtag #1MilMinds sort of tagline, and tweet to your MEPs. If you're a partner and an ally, please visit our webpage where you can endorse the manifesto, put your signature to it. And for any individual attending today, not sure what to do next, go to the campaign webpage and you will see there we have lots of information about what you can do next. Take a little step, take one step, and soon you'll get more and more involved. I'm going to just open it up to my team. If there's anybody here would like to intervene, please do so now. I can see some of your faces, not everybody. It's so nice to see so many people here. So unless you raise your hand, I'm going to finish off this webinar. Thank you so much for coming along. Your presence here is invaluable and it really energizes us in EMS. Excuse me, I'll speak for myself. It really energizes me to see so many people interested in the work of EMSP, in what we're doing, and also to see people, yeah, sort of row in. There are lots of other phrases. I wish you all a brilliant day. Remember, today, if you've nothing to do even if you've something to do between 3 and 4, please let's make a splash together with the 1 Million Minds campaign on Twitter, on X today, and share, like, and use your socials. And in the weeks and months ahead on social media and in real life, tell people about the manifesto, tell people about what we're doing, and share with us how you're getting on. If you need some help, please get in contact with us at EMSP on any of our socials, and we'll get straight back to you with lots of other ways to move and to continue the momentum. So thank you so much, everybody. We'll see you later on socials, on X, during the Twitter storm. And as I said, there have been some questions come through, and we'll endeavour to answer them, if not today, later on in the week. So thank you all very much for attending. And I would like to say that's the close of our